And good evening. I think I have a few more days to say Happy New Year. Ba-doom, boom. I'm Dana Wint. Thank you for joining us today on this Equal Hope segment right here on CAN TV. I'm so happy you could join us. You could be doing a lot of things, but today you're going to get some information. I'm the Community Engagement Specialist for Equal Hope. Equal Hope is a nonprofit organization with a mission to eliminate health disparities in Illinois, preferably right here in Chicago, starting here. We do this by offering free services, my favorite four-letter word, free. Free mammograms, free cervical screenings. We'll assist you with vaccines, HPV vaccines, the COVID vaccine, flu vaccines. We link people to medical homes. If you need that first primary care appointment, we'll get you into one for free. And all you have to do is give us a call, 312-942-3368, or you can visit equalhope.org. We have a Latina navigation team waiting to support you. No more excuses. Don't deny, verify. That's all I can say. Early detection saves lives. I want to introduce, the time goes by really fast here. I want to introduce our guest today. His name is Pete Perkins-Hurd. He's a multi-potentialite. These new words. I love it. A multi-potentialite. An entrepreneur writer. He's a sickle cell warrior activist and an equity strategist. The brother's bad. And we're talking to him about the unseen struggles of sickle cell disease through the lens of a patient. Thank you for joining us today, Pete. You could be doing other things.
Damn, no, I couldn't be doing anything other than being on your show today.
Sounds good to me.
Yep.
Pete, I think we're going to share some great information because this is a disease that does not get a lot of exposure, doesn't get the limelight like some of the other diseases. So let's get straight into it. In simple terms, tell us what sickle cell disease is.
So sickle cell disease is an inherited chronic genetic blood disorder. And it results when one or two of the parents end up being carriers. And you can be carriers in a variety of different ways, through the trade and through other lesser known genetic disorders and traits. And sometimes that results in you passing that combination of your genetics result in having kids having the full-blown sickle cell disease rather than them just passing down the trait.
Okay.
So with that, that's the very simplified version of sickle cell. Like regular cells are shaped like donuts, right? We've all had biology 101. My cells are shaped like crescent moons. And that can cause a variety of health issues because of how important blood flow is to, just every day what your body needs. It can cause shorter life expectancy, but the most it can cause issues with your liver, with your kidney, going to other illnesses. Issues breathing, you have a decreased immune system, so you're just more susceptible to a variety of other, medical issues. But the main thing is you have what we call sickle cell episodes or sickle cell crises, which are, reported to be, and I can attest to this, some of the most painful experiences someone can have for a medical reason. They feel like, people describe them in different ways. I've said it feels like, I'm being, frozen, and then set on fire, and then stabbed through, other people describe it other ways,
And this has been, as far as all your life?
All your life, yeah. You can get tested at birth, and most states, if not all states here in the U.S., as well as the U.K., is really big on testing. They were not testing until I have a younger sister. She also has sickle cell disease, which is actually rare for the two of us. She had a lesser chance of having it, considering that I had it. But my mother, because I had it, made sure that my sister was tested. But it took many years later for her to make sure that in the state of West Virginia, all newborn screening was, required for sickle cell. Like, she made sure that that was a state mandate.
Did she
No,
know?
she made sure that law was passed in the state of West Virginia. She was instrumental in that process.
Policy, gotta change policy.
She was a policymaker. My mother is a phenomenal woman. She's
I love to hear that.
the preeminent expert in sickle cell in I would say the world. There's not a handful of anyone
What's
that
her
knows
name?
the sickle cell. My mother's name is Nichelle Perkins.
Nichelle Perkins. So did Nichelle, did she know that she had the trait?
She did know, and through dating experiences, it was actually my dad. Men sometimes were arrogant, and he didn't think that he had any.
He didn't know he had the trait.
He didn't know that he had anything that would result in any, disease producing.
And so, as a baby, babies experience these crises.
Right.
Oh.
So my earliest crisis was my first Christmas.
As a 1-year-old.
As a 1-year-old. So.
Wow. Okay, so the question isn't when were you diagnosed, because everybody with sickle cell is diagnosed at birth.
Yeah.
There is no timeline on that. As far as symptoms, you said you started experiencing your symptoms at age of 1, but you couldn't describe it
Right.
to anybody because you were 1, and so your parents just have to be on the lookout for.
In terms of fevers, that's what you look for in newborns early on. Just increased irritability, but primarily you don't want them. With any time a sickle cell patient, a sickle cell warrior catches anything more than a common cold can really go south for the health. It amplifies the crises and can trigger or, like I said, amplify an already ongoing painful crises.
So, if 2 people, each one has the sickle cell trait,
come together, you have a 24% chance in that child having sickle cell disease.
24%.
I'm sorry, 25%.
25.
I'm thinking 24%.
Right.
Shout out to Kobe Bryant.
What do you mean, Kobe?
24. That was his number.
Oh, okay.
Rest in peace.
Okay, so 25% chance if you have a trait, your partner has a trait, and you come together, your child has a 25% chance of having the full-blown sickle cell
disease.
Now, or is there a chance that the child won't have the trait?
I don't have the trait. I have sickle cell disease. My sister doesn't have so if our kids might have the trait, but they wouldn't have the disease.
Unless if you got...
they could have the disease. We could very well pass it down, which we're mindful of, so we're not going to do that. Right. But, we're speaking positivity in the world.
Absolutely. Yeah. Absolutely. So, but I guess, that becomes an important part of the process in deciding who you come together with.
Yeah, that would be
You'd be like, listen, honey, I'm going to have to ask you some hard questions here.
Yeah. I could be in love with someone who had the trait, and we love each other, but we can't do that. It just wouldn't be fair to the kids, and it wouldn't be fair to her. It just would be heartbreaking all around. So just awareness, and that's why we're here today. Thank you for having me on your platform, and that's what it's all about, helping people just be mindful of the decisions that they make, because it's an all-encompassing disease. It affects every part of your life.
And so And the part about the sickle cell disease, it just doesn't get the attention. I mean, the limelight, probably not the funding
at all.
at all.
And it's the number one genetic disorder in the world.
And it's also
Blood
considered
disorder,
a black person's disease.
Right.
Which
is interesting because it's also Greeks, it's also in the Mediterranean, as well as in certain considered Arabic countries, Middle Eastern countries, can also have sickle cell disease. At camps, we had people, we had black people, we had people from the Caribbean, we had people from India, we had people from, islands, from Greek and Italian ancestry, Spanish ancestry as well. All.
Okay, so everybody came together, and as you said, a camp.
At sickle cell camp, yes.
Yeah, and I'm sure you have a network of warriors that you've met over your lifetime.
Right.
Is there any common thread that all of you can't all say all feel, but maybe all experience some type of discrimination with the disease of sickle cell because it's just, not talked about, or the Arab people are getting discriminated because it's considered a black person's disease, and then the black person is, of course, getting discriminated. So what do you find in there?
So the commonality, I would have to say, because you're right, the treatments between the different backgrounds are drastically different.
What? Now that's something.
Yes. So because we know that there is a medical disparity in this country as well as other countries as well, but particularly in the U.S., and it affects particularly black women. That's why the work you do is so important. But to go back to your question, the common thread is people really just don't understand sickle cell, even on a casual level, and they don't believe sickle cell patients. They don't believe sickle cell warriors. So when they're having symptoms, when they're experiencing a crisis, it takes, your word, you just have to go above and beyond to prove again and again and again. And a lot of the times,
because you can't see.
You can't see it. It's an invisible illness, like most chronic illnesses. I'm sorry to interrupt. No, not at all. But with that, it makes it more difficult for people who aren't familiar, even doctors. So it's not just a casual layperson, but it's a common person. It's even the medical field, not being familiar with sickle cell at all. I've had plenty of nurses say, "Oh, well, how long have you had sickle cell disease?" Well, since birth. You know what I mean? And some of them have been asking in good faith, just being friendly, and I don't have a problem. That's when you share knowledge with people, and they're asking so that they can know better for the next patient, hopefully, or that they can do better for the next patient. So if I'm always willing to be the test subject, if I have to be the one that receives the word so that there can be improvement, better long term for the sickle cell community, then I'm willing to do that. But
that's a warrior.
Yeah.
That's a real warrior for you, huh? Okay, so you said there are different treatments across the board. Hello, please expound.
So the number one thing that happens right now in terms of how black sickle cell patients are treated, and that it is labeled as a black illness because it predominantly affects black people. Those other groups are considered, outliers in the health community, but they can have it as well. So it's just important to, talk about things comprehensively, right? But right now, in conjunction with the opioid crisis, most sickle cell patients are treated like they're drug addicts or drug seeking.
Even though you, on your medical records, clearly state what your disease or condition is, So you're saying when you present at the hospital with in a crisis, they're thinking that you just popped up.
Yeah, they're thinking, they start this connotation of, oh, well, there's a lot of sickle cell patients are drug seeking, when the statistics show that only 2% of sickle cell patients worldwide, and it's in the country as well, the statistics are almost identical, have ever become drug addicts. So that's lower than just the general population. The probability of someone just you randomly know becoming a drug addict, it's not even a vocal point. It's nothing that should even really come up. Yes, because of our chronic illness that, is a life-changing illness. It's one of the hardest illnesses a person can have. Some studies show that the quality of life is more stringent than that of a cancer patient. And because we have this disease our whole lives, with cancer patients, you either get treatment for it, you beat it, or you don't, unfortunately. With us, it's more of a progressive, ongoing thing. You can get better sometimes, you can get worse. Sometimes you have different periods with the disease. Sometimes you can go a couple of years with maybe without a hospitalization, and other years you might be in the hospital 6 to 8 times or more. It really just depends.
Is there anything a sickle cell patient can do to help prevent the crisis, or is there a lifestyle that you can have that make a difference?
Awareness is key. Knowing your body, knowing yourself, and doing the preventative things. So drinking water, staying hydrated at all times.
Which is always good for your cells.
Yeah. Staying healthy in general. Staying away from just not trying to get yourself sick. So I recommend sickle cell patients still wear your mask. If you can, I know it may not be fashionable. I know it might make you feel awkward, but just do it just to prevent anything. Lowering the chances of you catching the flu or pneumonia or something. And just knowing your body, taking the medication, and being open to trying new things and seeing what works. I think that's the number one thing.
Which is like clinical trials. I mean, what's the clinical trial space look like in the sickle cell world?
There's not. It's an interesting space. There's a lot more than there used to be. Within the last 10 years, there's definitely an increase in clinicals, but they're not available to everyone, and it is based on location. So you do have to take that into account, and a lot of times they are underfunded as well as being underpromoted. So you have to be with the right doctors who are really going to advocate on your behalf to get you into a lot of these programs.
Are there any demographics? Are there any? I mean, it's an inherited disease, but are there any places that have higher concentrations? Are there cities or regions? Any particulars like that, or just?
I think the studies are a little bit old on this. New York supposedly has. New York and Florida kind of go back and forth between having the most sickle cell patients in the country. Then I think Chicago is somewhere top 10, top 5. DC as well, and then for whatever reason, Atlanta doesn't seem to be too lower on that list, considering, as a city, it's, population. California has a fair amount of sickle cell, but it's the data on that I think is.
What about the continent of Africa?
Continent of Africa, it's primarily on the west coast in the continent of Africa.
West Africa.
The Caribbean has pockets of sickle cell as well, and then the UK is doing a lot because of their healthcare program in terms of the research.
It goes by so fast, but listen, I recall when I first met you, you had a very compelling story. of discrimination as a sickle cell patient. Can you tell us that story?
So,
Help them.
yes. So I went in 2024, in August of 2024. I was
5 months ago.
5 months ago. It was, time goes by fast, but
4 months.
and to be honest with you, I'm still recovering from what transpired during that hospitalization. So I was, the last few years have been harder for me with my sickle cell in relation to previous years. Normally, I maybe have 2 ER visits
A year.
a year, and then I have 2 ER visits and maybe 2 hospitalizations per year, and then I just try at my preference is not to go to the hospital because I know that the mistreatment is going to occur. I know I'm going to be maligned. It's just never a great experience. Typically now, since the opioid crisis has, so with that, the what happened was when I received there, I went in the past couple of years. It's increased to about 4 hospitalizations per year. Okay, so make a long story short, I go to the hospital. I had to wait, which awfully long time, which that's a problem within itself, in pain, and because again, the believability. So I guess I didn't look sick enough. I had a lot of people went ahead of me because of need, but sickle cell patients are supposed to go first because of chronic illness, and people really shouldn't be in pain like that. It does things to the body negatively. But I was there with the doctor, and when he first met me, he kept asking me why I came to this hospital. This was St. Alexis in Barrington, and I live in the northwest suburbs, and the hospital is 20 minutes from my house, and he kept referring to me living in Chicago, even though I told him, and you can see on my records where my address is. I've had the same hematologist for 15 years, and he just was like, well, I don't know a lot about sickle cell. I don't know a lot, and he wouldn't reflect on my records. It was just him saying he didn't know, but then he didn't believe me. And I would say, go back and check on my records. This is what I normally get. These are my normally prescriptions. But what he started doing was documenting the fact that I was a drug user. He labeled me as a drug addict. And then I had a family friend who's a doctor came, and my uncle, and he tried to help the situation. He was very rude and dismissive towards him. And at that point, I tried to say, hey, I don't trust you to be my medical physician anymore. And then they wouldn't allow me to fire this doctor. The hospital would not allow me to fire.
They said you had to keep him?
They forced me to keep him craftily. They came back, even though, I tried to go through the progressions of getting a new doctor. They went to the new doctors and blacklisted me and made it seem like I was a problem person, maligned my character, and this is all ongoing. So
It's happening now.
Yeah, we're trying to get a meeting with them. We sent out a letter about this, and now they're stonewalling, giving us dates to set up a meeting. And then I found out after I was, unceremoniously released I was kicked out of the hospital, actually, not to make it quick. And what happened was I immediately called my insurance and said, do not pay for these services. This is this might end up becoming a legal matter. The treatment I received here was unacceptable. And I just found out that I was still listed as a patient of his
now, even still?
Even still, just in December, because he said he was coming up, he wasn't going to treat them, so they sent me a letter saying, oh, if you still want to be his patient, if you still want this to be your physician, he can be. You just have to call us and let us know. So these things happen where it's like, oh, you have to help yourself. You have to be your own advocate. No one else will be your advocate.
Absolutely. Did you hear that? You have to be your own advocate. No one else will. I mean, that's heartbreaking. You're still going through. This has just happened. I talk about this all the time, the disparities in healthcare, and that's exactly why Pete Perkins-Hurd is here today to remind you that take care of yourself. You have to. We're going to continue this conversation on our new podcast, Equal Hope Podcast, because we're talking about disparities there too. So make sure you pay attention to the podcast. I'll definitely let you know. You can find us on Facebook, Instagram, Threads, LinkedIn, and TikTok. So please give us a follow. Thank you. Is there any way they can keep up with you?
Yes, I'm available on IG as Just Another Hall of Famer, and my podcast is the Trep Life Podcast, available on all podcasting platforms.
Trap Life?
Trep Life, TREP.
It's Trep Life.
Trep Life, it's an entrepreneur business-based podcast. And we do talk about sickle cell in there from time to time as well, so in health disparities.
It's Pete Perkins-Hurd, the multi-potentialite, y'all, and he is here today. And thank you so much for stopping by and dropping some pearls. Pay attention, you all. I say it all the time. You need some support. If you need a mammogram, cervical screening, or a primary care appointment, Equal Hope can support you. 312-942-3368. And we understand disparities, so we're here to help. Visit equalhope.org, and we're waiting on you. Tell them Dana sent you. Thank you so much, Pete.
Thank you for having me, Dana.
And so good luck with that situation. And y'all already know, pay attention. Pay attention. Happy New Year.